like to introduce Neeraj. Please introduce yourself and explain a little bit about what your organization does.
Sure, thank you. I'm Neeraj, and I work as part of a company called Moksha Data Studio. And we do work with nonprofits and government in a few different sectors, including healthcare. And one of the roles that we play in those kind of projects is helping to facilitate the data side of things. So sharing data between organizations and with recipients of care and services is what we focus on. And we try to bring a good design perspective to that as well to make sure that things are approachable.
Thank you. Amazing. And Aditi, over to you.
Hi, everybody. My name is Aditi. I'm the founder of a nonprofit called Nani Haveli. We've designed a 5-part methodology that addresses the hidden trauma and also just the hidden emotions that coexist in really vulnerable settings or settings of poverty. So I'm here in Texas right now, along with Demi and Neeraj, and I've done this work in Texas recently, most predominantly with a lot of Afghani refugees, but this builds off of work doing similar types of work in rural India. So anywhere where there's a lot of vulnerability, there's a lot of emotional distress. And so trying to find creative ways to make sure that people have the space to share that is my specialty. Previously, I was vice president at NAMI Greater Houston. I began my career in consulting, and I'm trained academically as a development economist.
Amazing. And of course, we have Chaitali here, who is my colleague and friend. Please introduce yourself.
Thanks so much, Sarah. Yeah, I am a clinician psychologist by training and a part of the founding team at Wysa. So I've been at Wysa for 5 years now. So a lot of time has passed in which we've seen, tried to create access for mental health in different manners, and very, very excited about the partnership that we're doing with MyCHN right now to really serve rural health, community health, which I think is a deep, deep passion for the Wysa team. So really excited to talk more about that today.
Absolutely. In fact, it is our mission to help millions of people around the world, and we're well on our way, but so much more work to do. So, in fact, Aditi, you mentioned that you're all based in Texas and you're all in the sort of social good space, which is exciting. But if I can ask you to talk about your work in healthcare, and each one of you, what's the biggest challenge that you've experienced in your particular community? So let's start with you, Demi. The challenges that you face in your day-to-day role.
So challenges we've recently faced are primarily providing access to care for our patients that are in rural communities. Of course, we've had the big meltdown of Medicaid rewind, where a lot of our patients have lost their healthcare insurance, and so they're unable. They're now uninsured, are waiting for that insurance, and a lot of patients that should not have never lost it as well. They just did one big swoop, and so they snatched it from people who really need that insurance. That along with the people that were given it for COVID, which is what they were supposed to take back, but they took it from our patients that really, really needs it. And so that's been a really big challenge for us, is still trying to figure out how do we provide them care? How do we bridge the gap for those patients that their acuity level or severity level of need for services is on a high scale of need. And so for them to just snatch that away, that's been a huge challenge for us. And then of course, as we talk about access, then we know that there's also a shortage of staffing now in mental health and behavioral health, in healthcare in general. And so that shortage means that we have supply and demand. So we have more patients that need to be seen that end up being on a waiting list, waiting for care, that can be treated with the current staffing that's available. And so I know that's nationwide and probably geographically countrywide, but that's some of the hugest challenges we face, is being able to provide that access for our patients in real time to meet their need, as well as the lack of insurance coverage that they have to be seen when they can be seen.
So tell me more. I mean, that's a massive set of challenges. What and a huge elephant to start eating. Where have you started?
So for us, this is one of the reasons why, let me just say, I love CHN. And as I mentioned, we're a federally qualified health center that provides care to Medicaid, Medicare, all insurances, uninsured. We really go out of our way to meet the need of the community that we serve. That's very important to us. And we believe in the values and that mission. And so saying that, I say it because we spend a lot of time trying to gauge how can we meet the needs of our community? How can we help our patients? How can we be there for them in their time of need? And it's one of the reasons why we started considering digital apps and platforms. We try to stay ahead of the curve to see what's needed, what's coming down the pipe, to assist us with providing that support and care to our patients. And so we came across Wysa, and after vetting them and meeting with them and collaborating with how we'd like to see this app work for our community and how we could serve the community using this app, we were able to come to an agreement and to create an app to really serve the population of people and meet them where they are. And I could go more into depth, but I'm trying to leave room for other people to speak about it. But I have a lot to say on this topic. So,
I mean, don't let me stop you, but let's come back to it. So Aditi, have you seen the same kind of challenges? We've talked about access to care in rural communities, the lack of Medicaid support. What challenges have you seen in the communities that you're serving?
Well, the problem of insurance for the vulnerable in Texas is well documented. The route to disenfranchisement for my Afghani refugees is slightly different than those that were kicked off Medicaid, but certainly there. I think the additional challenges that I see are, I'd say that there are three that really stand out to me. One is a profound sense of loneliness and disconnection. Even in apartment complexes where, there's a certain vitality to community life that we don't experience in suburban American life, people are not, just as we've all experienced at a party or anything, just because you're around people doesn't mean that you're actually nurtured at that really deep level that everyone needs and needs even more. So I think a profound sense of loneliness and disconnection is one. The second thing I would add is while I was at NAMI, I led a piece of research that suggested that, the pool there was anybody who experiences kind of a mental health struggle or the caregiver of someone who does. And we found that people experience medium crises at a rate of 5 to 1 of severe crises. And the way that we defined medium crises was something that leaves a painful or traumatic memory, but isn't necessarily imminently life-threatening. And, those medium crises and the radar that we have in society to pick up and notice when that kind of reverberation that hurts is happening is so it's so unknown and it's so hidden, but we know that that's what ends up being a tsunami of despair eventually. And so noticing and then of course caring when people are going through those medium crises moments. It could be, chronic pain and a bout of chronic pain. It could be episodic anger that's really painful to a family member that's a caregiver. There's a lot of different examples of what that is, but they're so unnoticed. And then the third thing I would say is that, we've become as a society so obsessed with healthcare instead of health and care. Healthcare is so, it's become so administrative. And logistical and transactional when the root of it is supposed to be a relationship. A piece of research that really changed my point of view on this issue is Hilary Cotton is actually like a welfare specialist from the UK. She's coined a term called relational welfare, but she did this ethnographic kind of deep dive into one family and their 30 years of care of like travel through the welfare system. And basically like in one chart, everything was noted, and there was like one relational interaction and like 200 dots that were somehow administrative or reporting oriented in nature. And so even when after all these barriers people get themselves to a spot of healthcare, making it relational and making it really able to, in a reactive way, solve that person's biggest pain point at that time is it's so hard. And I notice that a lot with the communities I work in as well.
And those barriers are often internal as well for people. I would say from our research, the barriers are not only encountered when you decide to reach out for help, but also internal barriers, the classic problems of people thinking that they can cope, thinking that they're fine, or just plowing on regardless. The internal barriers are just as huge to climb. And Neeraj, I know that in your work, you've done a lot of work in trying to overcome those barriers. Tell us about the challenges that you've encountered and what you've sort of done to try and resolve some of those challenges.
I think both Demi and Aditi put it really well, and I'll try to build on what they said. The barriers that we've been talking about are higher for people who have higher need. And that's something that I think all of us see. And when that happens, people in a bad situation get worse. And that's something none of us want to see. And so as someone who's worked in healthcare and worked kind of in the role that I work in now, something that I cannot ignore in that work is the in between times. It's when you're in the room with your physician, you feel safe, better, you're getting better, even if you haven't even been diagnosed yet. But let's say you get a referral and now you're waiting, you're guessing, you're worrying. That can be really painful. And that's sometimes the worst part of the entire experience, is that in-between time. And so, Aditi talked about these different dots. And I think one of the things that we work on is to connect the dots. And the way we talk about it is working to close and shorten the loop when you talk about referrals. And sometimes there are these open loops. In other words, someone will get referred somewhere and the person who made the referral doesn't know what happened, and the person who is supposed to go and redeem this referral doesn't know what to do, and they may try to go and visit that place, and then the information that they received was wrong and they can't get the help they needed, and there's really no closing the loop there. And so we're working to change that. We are focusing on closing the loop between healthcare and social services, and we're starting with food insecurity. So if someone screens positive for food insecurity, then they'll get a referral to go to a food pantry and get food. Then the person who made the referral should be able to see on the health record for that individual that person received the food. And if they didn't, they'll be able to follow up. That's kind of the first project that we're working on. And the idea is to go beyond that, because if you imagine someone has food insecurity, that by itself is at least a medium crisis, to use the framing that Aditi gave. And they're going to need mental health support as well to kind of recover from the experience of having food insecurity. And a lot more people have food insecurity than you might think in the United States. And so this is where we're starting, but it's definitely supposed to be a blueprint for closing the loop in other areas around healthcare.
What a fantastically powerful example when you bring it down to such a basic need as person needs food, person applies for food, person gets food. It makes it sound so clear and simple that, of course, this is a process that needs to happen. But when a human system is involved and someone has to go through a sequence of steps that's managed by humans and led by humans and passed on in paper format, which it so often is, not just in the social support space, but across the entire healthcare system, even at really high level, when we're talking about people that have got extreme physical health, we still see a paper-led, human-led access system, which is just extraordinary and can so powerfully be resolved, which makes it a good time for me to hand over to Chaitali to talk about what Wysa has been doing specifically with CHN, but also in a more general healthcare setting to help resolve some of those access issues. Chaitali.
Yeah, I think, and again, in some ways, I'm building a thread right across what everyone's shared so far, that probably have been some of the reasons as to why we even wanted to create this technology. That I think those gaps in care, that how can you bridge that, where very often as a provider that you can't be there, even if you really want to be there for the patient. Can someone be there? And I think it was in response to that internal question that I think we started to think about Wysa as potentially a response to that. That one of the ways I think is, of course, through a triaging mechanism, that can someone get in the door faster, that they've pulled together all this internal motivation, have finally figured out who to contact, which clinic to go to, but it's still such a long line before you're finally able to see a doctor. Can we make that a little bit easier? And I think the second part of the element was exactly as Neeraj said, that those periods of fear, apprehension, worry in those in-between times. When you're waiting, now you're in the system, but you're still waiting. It may be a couple of weeks before you finally see someone. Or there are gaps between your sessions, which is normal, which is standard, that every weekly session. But what happens in those 5 days or 6 days? How do you manage your mind? How do you hold yourself together when there's still some time before you can see someone again? And I think there are just so many scenarios, right? I think I could take the entire hour if I just start listing the scenarios of the many, many ways in which we all stay isolated in our own little silos. Whether functional or dysfunctional, but the world is inherently always building silos for us. And I think our hope was to do the inverse than what technology usually does, that breaks some of those silos. So build bridges, as opposed to saying that this is all that you need. Talk to this chatbot and everything's okay. That's not the intent, but the intent is that if you can create a bridge between all the places where you can meet humans that care, that can provide you what you need right now, and that's a good use of technology.
Perfect. And in fact, what you have done there is perhaps for some of our people who are joining us might not realize, but that Wysa is essentially a chatbot that delivers cognitive behavioural therapy for people suffering depression and anxiety. And what a mind-blowing thing that must have been to introduce to your team, Demi. How did they first react? What were their hesitations? Did they have any fears, or were they just like, yeah, bring on the robots?
Well, we know that there is still a lot of fear attached to AI and using digital platforms and security of it. How confidential is it? Are people going to be able to access my information? But for our team, just like with our patients in the community we serve, education is the key. So educating our team, educating the population of people that we serve about the benefits of AI. I really like that what my colleagues here, the panelists, have touched on. I have so much to say about this loneliness that people are experiencing, social determinants of health as it relates to food insecurity and meeting people where they are, meeting that need for them, whether it's housing or food or being able to keep the lights on, families having to crowd together and live together in one setting just to survive and thrive. And so being able to educate them and provide a digital app that they can utilize to be able to talk to the chatbot and get some feedback, or just be able to use meditation or some of the cognitive, it's a plethora of a library that we're offering in terms of education and skills building and different tools that they can utilize, imaging and meditation, yoga, that they can utilize to be able to bridge that gap, to hold them over. So, the question has come up many times. So is this going to replace therapy? Are they not going to, are we going to be out of jobs as it relates to AI? A lot of people have that concern. Watching too much of the Terminator. That's a long ways off if it were to ever come. So being able to understand AI and the advantages of bridging the gap that it serves, to be able to give people something that they can hold on to. We know that we've already moved to a platform of people living online, on their phones, on their tablets. I mean, that's where people live now. Even when they live together with family, even when they go out in public, they've lost the ability to socialize. They've lost those social skills, which reinforce the internal loneliness. It reinforces being in a room full of people, but still feeling alone, because we live here now. Everyone is here, down in their phone, in their apps. But if we can provide, if I'm going to live here, being able to provide something in my hand that can help me, that can teach me skills, that can educate me, that can help me to get out of my head, having these negative thoughts and negative self-talk, but being able to provide some positive self-talk. And in addition to that, what I like about Wysa app and the way we set it up is that it pre-triages people. So we've added the screenings to be able to see where you're falling on the scale of depression, or where you're falling with your anxiety. And then we didn't just add it for you to screen and see where you fall, but then we offer, based on your scoring, the connection, real-time connection with a person who can provide you with assistance, who can be there to talk you through whatever it is, or provide you with that appointment sooner than later to give you the care that you need. And so, and to connect you to resources. We have a social determinants of health department to connect our patients with resources and to close the gap, to close that loop. I like that Neeraj spoke on that, so that we can make sure we don't just give them the information, but that they were able to access those services, their needs were met, and that we follow up with them. So that's some of the steps that we're taking to be able to bridge that gap and meet our population, to be able to provide services for them.
Perfect. And you're absolutely right in that we also have fears from our audiences that says, well, surely giving people an AI bot to chat to isn't the answer. The answer is human connection, and absolutely it is. Human support and human connection is the answer. But if people are too afraid to get it, too depressed to get it, too anxious to get it, then we can't get them there. And that's entirely the point of giving them, like you say, something to build those skills, build up that resilience, and build up that confidence to be able to go out there and do it. So Aditi, I wonder if you could tell us, the essence of your work is human connection, is bringing communities together, and you talked to us earlier about using music and arts to help bring out emotions and deep-seated fears. How can your communities, which are very much human first and human led, how can technology help your mission?
Yeah, I think a lot of us have talked about how much we realize that this human connection is the ideal, and then what do we do in all the in-between spaces? So one design principle that I like when I'm thinking about technology is, how can technology extend the impact of a human connection moment that we've engineered together? And so I think also, like, just in general, I'm kind of not a Luddite, but I'm not like very techie. And so, I think there's all sorts, and I think we need to, thicken the dialogue to be beyond extremes. And so there's all sorts of, relatively speaking, low tech ways that make a profound difference. So I'll give you two examples. One, and they're all like, most people will probably like laugh and be like, this is not technology, but it was in the context we were working in. So one, when I was working in rural Uttar Pradesh, we do our sessions in the middle of a village. And so how do I, in a really magical way, introduce a bit of film or a bit of music? And a lot of people were like, oh, Didi, we have this like great projector. But the projector, again, is big and it takes everyone's focus into one direction. And so we created, I was working with a team at MIT at that time, and we created a small app that allowed for sync viewing. It was like the feature I was most obsessed with. And everybody was like, let's just give it the synced viewing feature. But what it let us do is experience a piece of art together while being in a circle. And these are also basic human technologies that have like passed the test of time, a campfire, let's say. So now if you want to elevate the campfire feeling to include experiencing art together, having us all be in a circle watching a piece of art all together in the middle of a village and then talking about it was allowed for a profoundly different type of connection and sharing. And so that's something about how technology can, in the moment, deepen human connection. A second example is, I think one of these lines that's really changed the creative approach to my work is this idea that memory is a poet, not a historian. And I think about memory a lot when I'm designing my methodologies. And if we accept that memory is a poet and not a historian, then we accept not everybody's remembering self is naturally a poet. And so a lot of times, a few audio clips of our in-person interaction, a few video, like kind of a reel that like is a little bit of a voiceover of what we did together with a few little moments of video or photo, sent over something as simple as WhatsApp, can profoundly extend the memory of what we achieved together and that halo effect that happens after we've connected. So you can really get the most out of what are those few and far between moments of true human connection. So those are two ways I think about with that overall kind of guiding principle of how can technology help extend the impact of human connection we have.
That's amazing. That's such a powerful and beautiful way of looking at things, and even of looking at technology to say, do you know what, let's look at the most basic form of technology and the impact it's had, like the fire in the middle of the room. Absolutely. We all stare at it. We all respond to it. Amazing. So Neeraj, you're the tech guy here. What's your vision of what technology could do to solve some of the big challenges that we've talked about here? I know that you're already using technology to solve things at a fundamental level, but what's your big picture? How do you see things in 10 years time, 20 years time?
I think technology needs to start by solving the problems that it created. Ooh. And so what I mean by that is, for every system that we implement, we create a silo of information and context. And so where we are today is we're kind of standing at this place of tremendous amount of information, where we have so much information, but it's in pockets and it's hidden and it's not accessible. And it creates a lot of extra worry and work to try to put it together. And people don't have time for that. And people shouldn't be spending their time on that. So I think that technology needs to start by kind of abstracting that, in a sense, from people, so that they can get back to the human connection that we're talking about. And so some of the work beneath that can be very technically sophisticated. It can use things like, machine learning and other advanced computational resources to achieve this, but nobody should have to worry about that. The goal is that people should just be able to show up somewhere. Oh, it's nice to see you. We were expecting you. Like that type of experience that just feels so nice. is what we need to do, instead of I show up and I'm greeted with a piece of paper. Even though I already made an appointment, they don't know who I am, so I have to fill out a paper to explain who I am after
these
I
days
filled
an
out a paper.
iPad. Yeah,
or an
absolutely.
iPad or whatever that is, right? I'm greeted with something in my face instead of another face. And so what we need to do is actually see where technology can remove itself from the direct experience. And we need to do this in responsible ways. We need to think about, okay, in order to achieve this kind of magical experience, which is now we're describing as magical, but it really is the way we used to do things before technology. How do we do that in a way that's, people's privacy is being respected, and people's autonomy over their own information is being respected and honored, and their agency. These are the kind of design challenges that we have in the next, I'd say, 5 to 10 years, such that in 10 to 20 years, we're really back to where we used to be. But we're able to do more of it and spend more of our time with each other.
Amazing. So I'm gonna put this over to the floor, if you like, the audience, see if there's any questions that our attendees would like to put forward. But in the meantime, I'm going to pass over to Chaitali, who already did a midway summary, but has this ability to find the thread between what everyone is saying and pull it together so nicely. Chaitali, where is your head at? What is the profoundest discovery that we've come in this meeting so far?
I actually want to start with the lighter note, and I can't get it out of my mind, so I'm going to say it. That yesterday I read this statement by somebody, where someone was saying that I wish robots and AI could do my dishes so that I can do the poetry, as opposed to the robots doing the poetry so that I have more time to do my dishes. And I think that in some ways is a very succinct way of summarizing what Neeraj was also saying, right? That solve the problems that actually exist and what people are struggling with, so that we can get back to the human connection.
So they're not satisfied with a dishwasher?
Yeah, I think we need something more intensive, more rigorous.
Oh, fair enough.
But yeah, I think and that hopefully is where I see the fit of some of this technology too, right, that we're working on right now, that if we can streamline workflows and if we can make things simpler for a patient or provider, then that actually creates more time for the patient and provider to get in and not talk about those 200 administrative points, but actually spend time on that one single point of human connection, which actually will make the patient feel better and do better. And I was also resonating with what Aditi was sharing earlier about low tech being, I think, just as meaningful to think about as us saying that we'll completely recreate the wheel and do something profoundly different, and it'll be brand new technology that'll change the world. If we can just make technology useful, that's really, I think, the key problem statement. And we were thinking about that recently in the context of certain conflict zones and refugees that we wanted to serve, right? That if there's a disaster, for example, or if you're going in a disaster area or serving refugees, you may not always have the ability for Wysa to be completely online. And if Wysa could just have some means, some mechanisms through which we could do some basic behavioral health support or psychological first aid that is local, that can be hosted in a local manner, so that you don't need a mobile network even to be able to access that resource, even as you're waiting for someone to come up and talk to you. That really basic solution already exists in the world, but can have such a profound impact in how many people we're actually able to serve at their time of need.
And in really rural communities as well.
Exactly, yeah.
So we have had some questions in which my colleagues have kindly shared on the window for me, which I'll read out to you here and we'll farm out between us. So the first one is, how do you address the fear of some mental health professionals in using AI or being replaced by AI? And I mean, let's face it, this is something that so many people are worried about, having their job being replaced by AI, but this is specific to therapists. And I see it as myself in our global marketing. We have some therapists that are absolutely embracing Wysa's support and its capability, and some that are like, whoa, you know, this thing can reduce symptoms by 31%. This is dangerous for our profession. Put our fears away. Chaitali, help us here.
Demi, I'm actually wondering if you also want to answer this question.
I was going to throw it to Demi next. I was going to give you the answer.
Thanks, Sarah. Thanks. Sorry for taking over your job there.
I can't answer.
Go on.
So of course, anytime there's a new introduction of something into society, there's some fear attached to it, which is normal and natural. But nothing is going to replace human interaction. Being close to another person, the warm touch of another person reaching out and touching your hand, of someone giving you a hug, of making that eye contact with someone and feeling that they hear you, they get you, they understand you. So I believe that for therapists or people that have a fear of AI, they don't understand how we can utilize it so that we have more time to pay attention to our patients, so that we're not having to spend so much time documenting and doing the notes and all the other things that take us away from being able to connect with our patient. And that's not just for therapists, that's for physicians, for anyone in the healthcare, where we also, they roll in that little computer thing now when you go to see your provider, and they're typing all of the information and they're not really looking at you because they're trying to get the documentation done. So the benefit of AI that can sit and listen to the session and summarize it for you and give them a printout of what was discussed and what the instructions are and things that they need to follow so that they don't forget when they leave. That's a benefit that AI provides for us. Meanwhile, the professional can connect directly with the patient. They can actually look at them and stay fully engaged in the session and that time with their patient, versus to not being able to fully engage because they're also looking at their laptop or their computer. And so I'm never in fear of AI replacing me as a therapist, because the most important thing that can happen between a patient and their provider is that connection, that real-time connection, developing that rapport, hearing and understanding where we come from, and knowing that I get what you're saying. So yeah, AI can read from you what the educational book says. It absolutely can do that, but it doesn't have lived experience. And so it can never replace real lived experience where I get it because I've been through something like that, or I have family that have been through something like that. So I understand what you're saying and how you may feel. AI doesn't have feelings, not real feelings. They have generated feelings, and I know they're generating AIs that have feelings, but they'll never be the real human experience. So I didn't want to take it away from you, so I would turn it back over to you.
That's very reassuring, very reassuring. And we have actually got a related question from a different person. Who are initially the most cautious group when you're introducing something like Wysa or an AI-led solution? Is it the providers, the clinicians, the patients, the finance team, because you're asking for money? Who is the most skeptical that you come across? I'll give that to you, Demi, because you've been there and done it.
I would say it can be a good mix. So everybody has value in their thoughts about AI, and whether to utilize it from the patient, and you haven't access to all of their information and their security and their privacy, and who else is going to see this. Two, of course, finance team, anytime something new is rolled out, it can be pricey or expensive. And so is it the best utilization of our funding, to pay for these type of things versus to utilize it to maybe, cover co-pays to help patients or whatever. So it's widespread, not 100% equally, but enough that all concerns are real and validated. But I think what we're seeing now is that we have the tool, we want to roll it, we have rolled it out to people, and getting people to utilize it, to say, hey, here is something that can help you. So please try it out and utilize it so you can see the benefit of it. So that's why I say it's a little bit of all touching all those populations.
That makes total sense. So we have another one here. What are some of the challenges that FQHCs face in deploying tech solutions more generally?
So that and I'm sorry, I don't mean to be doing a lot of the talking. I do apologize to my panelists.
The questions seem to be coming for you. This is, these are your people, clearly, so they want to hear from you.
Okay. So as I kind of touched on before, so deploying this out can generate the same complexities that it does for people who don't have internet or access a good internet, or people who can't keep their cell phones on or don't have a data package or whatever to be able to tap into it and utilize it. To, if I'm sending out a blast that this is available to you free of charge, please use it. But are you getting it? Are those blocked because you need to watch your data coverage usage? So we get the same type of complexities in getting the available resources out to our patients that need it in rural communities, in low income, in affordability to afford it, not just to afford the app. We're offering it free, but if I can't afford internet, or if I can't afford my data package on my cell phone, then I still don't have that access to utilize it. So that's one of the biggest challenges we're having is now we have it for you, but how do I get it to you? And then how do I encourage you to use it once I get it to you?
Absolutely. Neeraj, do you have anything to add to that? You've obviously been deploying tech innovations for a good 7 years or more in your business. Are these the same issues that come up time and time again, or have you seen something else?
I think these are the same issues. There are definitely patterns that we see, and they're not easy. I think that it requires sometimes a level of coordination that's not normal between different parties. And I think that is, if I have anything to add, I think that is sometimes the hardest part, or the thing that takes the most time. I think, I've had projects I worked on where I wrote a solution down on a piece of paper in a matter of minutes, but then the project took years to actually show any fruit. And if I reflect on a project like that, it's not the technology that was taking the time, it's trust. And so I think that often when we think about implementing something like this, where we think it's a good idea and we think it's going to help people, we're going to be moving at the speed of trust. And so I think spending more energy on that and investing in that is important.
Would you agree with that, Aditi? The trust is the biggest barrier. The trust is a very emotive fear and feeling. Is that something that you would try and overcome in your work? If, for example, you were introducing some technology, could you help on that human level with the trust in this technology?
Yeah, I love that idea of kind of moving at the speed of trust. I undeniably such an important currency. I think if I were to put a through thread through some of the questions and my point of view on them as they relate to kind of, how do we trust this? I think you can always kind of tell if you're in a room of allies or not. So this is a conversation among allies, and we work on different aspects of this gnarly problem. And I think we all kind of are standing on this precipice of nuance together. But what happens at a system level is that once something starts generating momentum, you end up losing the nuance. And so all of us to hold steadfast to the nuance on a care level, CBT is something that is well poised for a tool like Wysa. It's predicated on if this, then that frameworks. There is so much therapeutic modalities out there that need something fundamentally deeper. So how do we shift what we are really good at to stay ahead of of that AI curve and use that as an internal kind of excellence drive. That's something kind of at an individual level. At a person level, at a professional or organizational level, how not to break trust. Something that I see often is that, okay, we start by saying like, this is additive. It's not either or. But then somebody in finance figures out, oh, we can just do this at 1/10 the cost. And we define success as symptom reduction instead of overall flourishing. And then before you know it, we just stick to, we got some symptom reduction at 1/10 the cost. This is the most cost-effective solution out there. Let's do it everywhere. Instead of saying, this is good for this, but we want to do step change in total wellness for the most vulnerable. And we keep that in mind. We use this as a tool. But I think in my experience, a lot of the trust breaks down because something that's meant to be additive ends up becoming the only solution. And so I think at an organizational level, how do we ensure we're not going to get a fast one pulled over our heads is important. And everyone should be working together to think through that.
That's a fantastically honest caution for any member of the audience that is here today, to bear that in mind when introducing solutions. I have one technical question here that's come up, which is, how do you handle emergencies or crises within the Wysa platform? That's a technical question. Shall we throw it to Chaitali?
Yeah, absolutely, Sarah. Thanks. So there are 2 or 3 ways, right, in which we manage that right now. But one, we have an SOS button that's quite literally there. So if you'd like to reach out for support, then we list down resources within the app that a person can access. But we, of course, wanted to always make sure that there was a system built in within the chatbot. So if someone is speaking to Wysa and there's a crisis that happens, they mention any language that indicates suicidal thoughts, self-harm, trauma, abuse, then Wysa is able to pick up on that. And what Wysa does is that it stops the intervention, redirects them to crisis resources and helplines, and then also does warm hand-holding where a safety plan is being built on the app with Wysa. So you're also managing that peak of the curve of distress. And that's something that's still being handled within the app, even as they're waiting to speak to a live crisis resource. And then Wysa is also able to check in later and say that, were you actually able to speak to someone? Were you able to reach that person? So that, that linkage is not lost, just in case the helpline was busy or anything like that. Those are the 3 or 4 steps that we take within the app to just make sure that the person feels held in that moment.
Fantastic. And in fact, we have coming out very, very soon a new report on how people interact with the crisis features within Wysa, how many people use them, how many people are AI detected versus self-selection, and what they actually do once they're in there. It's a fabulous read, and I would encourage everybody to subscribe to our LinkedIn to find out when that comes out. It's coming soon. Now, I have one more question which hasn't come up on the screen to me, but it was the very purpose of this panel here today, which is, can technology truly increase access for communities being served by FQHCs? That's the big question, and I'd like you to answer it in a nutshell. Chaitali, I'm being really mean.
I think access is really what I see as the key synergy between what an FQHC is trying to solve for and what technology is trying to solve for. And that skew, when demand and supply don't match, that skew is most heavily experienced by someone trying to serve those who are underserved, such as rural healthcare or federally qualified health centers. And that's, I guess, why I see this partnership as something that just makes sense. It makes sense that something like this should exist here, because if you can add even a basic layer of technology here and streamline that process, the impact is manifold. Like that magnitude is just so large because of the number of people that need to be served here. So I think those are the reasons because of which, yeah, I do think that technology can actually help how FQHCs currently work and serve the community. and it can add to the mission as opposed to taking away from it.
Perfect, perfectly summarized. So I would like just to completely finish, your peers are clearly in this room who we can't see, Demi. We can see that from the question. So what's your final message, your takeaway to give to your peers around the country?
Thank you. So the final message I would like to leave with everyone is the recognition of, as you talked about, access to care. So my thought is always something is better than nothing. So if I need care or I'm in distress and I need someone to talk to, but I'm not suicidal, so I don't need to call the suicide hotline, having a chat bot or something that I can talk to or kind of gauge my symptoms is a benefit to me. And if that holds me over or puts me on a triage list where I can be seen and someone is going to reach out to me and follow up with me, then that's an advantage, and it gives me a sense of security that I'm not alone. And so in a world where we feel very isolated and loneliness is become a huge crisis for us, having something is better than nothing. So while I'm waiting to be seen, then, okay, I'm gonna quit talking, but having an app that can bridge that gap in the meantime, that's a benefit. So that's what I leave with you.
Amazing. Thank you so much. And thank you to all our panelists here today, Aditi, Neeraj, Demi, and Chaitali. You've been amazing. We will be writing a summary. We'll share it with everybody who's registered by email. I do also encourage you all to look out for that report on the role of AI in a crisis, mental health crisis. Thanks very much, everybody. Bye.